Good afternoon, everyone, and welcome to our April ECHO session. My name is Benita Rokiraj, and I serve as the Population Health Analyst and ECHO Lead for the Constellation Regional Collaborative. I'm joined today by my CRC colleagues who will be supporting the chat throughout the session and admitting people into the room. If this is your first time attending, please stay till the end to fill out our post-ECHO survey to receive your certificates and education credits for your attendance today. Thank you again for joining us, and we're excited to dive into our discussion. I'll just share our agenda. We will begin with a quick round of introductions to help ground us who's in the virtual room, which will be followed by a didactic presentation by Avril James from Piedmont Women's Heart Health Program. And then we'll also have a case presentation by Michal Carlock, and both presentations will be focusing on holistic women's heart health initiatives. After the presentations, we'll open up the floor for questions and discussion. We really encourage participation here because this is where the power of ECHO comes in through peer learning and sharing across disciplines. And then at the end, we'll also share details about our next ECHO session, followed by some other agenda items, and then finally the post-ECHO survey that helps us continue to improve and tailor these sessions to your needs. So let's begin with introductions from our ECHO attendees. Please take a moment to introduce yourself in the chat by sharing your name, employer or organization, your position, and we also have an optional icebreaker today. And I stole this from another meeting I attended because it was very fun, so we'll see what responses we get today. The question is, if you could have any song play every time you entered a room, what would it be? Sweet Child of Mine, Guns N' Roses. Yep. Abel says, Don't Stop Me Now by Queen. Okay. I'll be listening to all these songs after our ECHO session today. Jump by Van Halen. Ooh, that's a new one. I haven't heard of it. Keep your responses coming. I will just move on to introductions from our team and subject matter experts. So I'll go first. As I mentioned before, I'm Benita. I'm the Population Health Analyst and ECHO Lead for the team. I come from a public health background, primarily in health equity programming. And I'm very excited to announce that we have a new team member today, so I'll pass it to Shannon.
Hi, good afternoon, everyone. My name is Shannon Robinson. I'm the new Quality Improvement Specialist here with Constellation Quality Health, and I just celebrated my 1-month anniversary yesterday. So very happy to be on the call today. Thank you.
Agner and Sylvia.
Go ahead, Sylvia, ladies first.
Oh, thank you, Agner. Good afternoon, Sylvia Coleman. I'm a strategy consultant with the team, and it's hard to believe that Shannon has been here a month, and yet it seems like she's been with us always. So welcome again, Shannon.
Good afternoon, everybody. My name is Agner Munoz Vasquez. I'm the Community Health Specialist for the CRC, our Constellation Regional Collaborative team, and also a certified community health worker. This is my 5th month already also. So Shannon, I'm not the newest one. Now are you? Welcome to the team.
Thanks, y'all. And then we have 2 additional team members, Maxine Arena, who's our program manager, and Sydney Fleming, who is our outreach and community engagement specialist. They're traveling back from a conference in New Orleans, so they will not be able to make it today. All right, and I would love to introduce you to our incredible Echo Series subject matter experts who help guide the learning, share insights, and elevate community-informed solutions throughout the series. We have 6 subject matter experts: Dr. Jeffrey Bretler, Honey Estrada, Emily Ridley, Drs. DePetty and Lackland, and Valerie Perez. And I know 3 to 4 of you are joining today, so feel free to come off mute and just introduce yourselves.
Well, hi, Benita and everybody. Good afternoon. My name is Don DePetty. I'm here at the University of South Carolina School of Medicine in Columbia. I'm the Distinguished Health Science Professor here at USC and the school, and I'm also advisor to the Regional Collaborative. It's wonderful to have met Shannon. Dr. Lackland and I met her yesterday, and again, Shannon, welcome. I'm an internist, a primary care physician, but I've spent my entire career in academia, as well as clinical care, education, and then clinical and basic science research, predominantly in hypertension and cardiovascular disease.
Thank you, Dr. DePetty.
I can jump in next. Good afternoon, everyone. Jeff Bretler. I'm an internist and hypertension specialist from the Kaiser region in Southern California, where I help oversee the hypertension program there. I'm also
Dr. Bretler, I think your audio is very faint.
I've been having problems with my audio. Can you hear me now?
Yeah, it's just very faint, kind of low.
Okay. I'll work on it. Maybe we can go on to the next.
Okay, thank you.
All right. Well, my name is Emily Ridley. I serve as a subject matter expert with the Constellation Regional Collaborative. I'm a clinical pharmacist based out of an internal medicine residency clinic within Prisma Health in Columbia, South Carolina, where we serve within our clinic primarily low-income urban population, but we do have a lot of rural patients as well. On a daily basis, I work with our patients in helping improve hypertension and diabetes control, which go hand in hand a lot, it seems. I've worked extensively with quality improvement efforts with hypertension control across our health system and served as a consultant with PAHO with Hearts in America. Nice to see everyone today and welcome, Shannon.
Thanks, Emily.
Hello, everybody.
Oh, yeah, go for it, Valerie.
Thank you. Hello, everybody. My name is Valerie Perez. I currently work for Youth Collaboratory as a technical assistant on HUD grants. So I focus mainly in the homeless response system, in which I'm a subject matter expert. And I am really excited to hear this presentation today.
Thank you so much. We are too.
Are you able to hear me better now?
All right. I can't go through the attendee list, but if anyone else is present, let me know. We will move on to the next slide. To introduce our didactic presenter of the day, we have Avril James Maynard, who has been a prominent yoga and meditation teacher in Atlanta for almost 30 years. She has served as an associate minister at Unity North Atlanta Church for over a decade. Since 2019, Avril has also been the coordinator of the Piedmont Women's Heart Program, demonstrating her commitment to improving women's health. In this role, she organizes events, leads health education classes, and provides physician-preferred individual and small group coaching for women with heart disease. She's an advisor to Stellar Roots Farm and coordinates field trips to the farm for the heart program. Avril holds a bachelor's degree in exercise science and a master's degree in public health. She's also a certified health education specialist and an ordained minister through One Spirit Interfaith Seminary, with extensive training in traditional yoga meditation and other yoga mindfulness modalities. Avril, thank you for joining us today and presenting in our April session. Please feel free to take it away with today's didactic presentation.
Thank you so much. Should I go ahead and share my screen?
Yes, and I will quickly make you co-host so that you're able to share slides. Yep.
It was already letting me share.
Oh, okay. Never mind.
It was working. You had. All right. Can everybody see my screen?
Yes.
Perfect. Awesome. Just making sure. So I'm very grateful to be here. Thank you so much for that warm introduction. And thank you for pronouncing my name correctly too, because that does not often happen. So I deeply appreciate that. And again, my name is Avril, and I'm Piedmont Women's Heart Program Coordinator. All right. So our program is addressing, as all of you are, disparities in healthcare. Many of you probably already know, but in case you don't, women are more likely to die from men than a heart attack and more likely to develop heart failure within 5 years of discharge from the hospital. And obviously, having high blood pressure is often underdiagnosed in women, and fewer than 1 in 4 women with high blood pressure are managing the high blood pressure well, even though there's wonderful interventions, both medication and behavioral, that could really support that. And unfortunately, Black women have a higher prevalence of morbidity from heart disease. So these are all issues that we are trying to address, as well as rural adults in general having significantly higher risk of cardiovascular mortality. So as far as cardiovascular disease affects women specifically, we have our non-modifiable risk factors, your age, your family history, your race, your ethnicity, but women have other risk factors that are sometimes not addressed even with a cardiologist. Autoimmune and inflammatory diseases like lupus, which disproportionately affect women, can affect your vascular health. Polycystic ovarian syndrome, pregnancy and postpartum changes, as well as menopause, the loss of estrogen, can also really affect microvalve disease as well. And these are just areas that we're trying to put more attention in because they're a little bit underappreciated. So the modifiable risk factors can really be changed with some good education. And 82% of heart disease occurrence could be prevented with a low risk lifestyle. But that's a lot to ask. A lot of people are going to have behaviors they engage in at one part of their life or the other. But the good news is that even if they miss the prevention on the front side, that we can lower death by 50% if we adopt behavioral changes, even once the disease diagnosis is established. And I love this idea that we're not telling people they need to be perfect, but we're going to try and empower and optimize the resources that they have and educate them to be more discerning and make better choices going forward. So our program, this is like our mission statement. We are a comprehensive holistic wellness program, and we seek to both prevent and support. So that's something I really want to highlight, that not all of our participants have been diagnosed with cardiovascular disease. And that's really exciting because we're hoping that we can really shift these outcomes later on. We offer high quality education and wellness coaching, and we focus on total health through nutrition, exercise, and stress management. And we're also fostering community. We are connecting women with other women who are engaging in health promoting behaviors. We are a free program that depends on philanthropic support to promote equity and accessibility for women of all backgrounds. So our program essentially has 4 components. I will not be speaking as much about the cardio obstetrics program, but in the wake of what I mentioned previously, that pregnancy, postpartum, and during pregnancy can greatly affect cardiovascular outcomes, you can see why we've added this element. In the last 3 months, we've hired a coordinator specifically to address cardio OB, and this is primarily referral that's expedited from OB to cardiology, especially for things like preeclampsia and gestational hypertension. But there's a lot more with that, and our intention to keep connected with these women after the 4th trimester and feed them into the Women's Heart Support Network for the greater good. So then the next component of our program, which was really where the program was incepted is what we call the $99 screening. And I know that seems contradictory because a moment ago I said that our programming is free, and that is true as far as our education, 100% free. Our classes, 100% free. Our coaching, 100% free. But we came about with a $99 screening. And the screening entails, I'll talk about that a little bit more, but some really robust testing that can help people catch things earlier, or at least be aware that they're maybe on a trajectory for some health outcomes that with that behavioral change, they can make differences. Wellness coaching is a physician or APP prescribed 6-module program that we offer. So these will be women who are generally diagnosed with cardiovascular disease. We're making some capitulation also for women who've done the screening. It's an initiative also to do the screening. Most of the women coming here have hypertension, diabetes. Several of them have had MI, or a few have had stroke. And what we're doing in that 6 weeks is we are really informing them about all the options that we have in the program to help them utilize it more maximally, more efficiently. And then we work on, we use ACT, acceptance and commitment therapy, as a model for behavioral change. So we distinguish, we distill their values. We work on SMART goals, and we set them up with an accountability partner. They'll actually have 3 partners during that. And I'll talk about this more. And we're really excited about the community that we're networking, that we're knitting together, a really strong network of women who are engaging in amazing and productive behaviors. And then the last part of this is the support network. That's our big education arm. That's the biggest component of the Women's Heart program. So the screening that I mentioned, the reason that it's $99, and we're working on different ways to do a hybrid variation of it as well, so that people don't have to necessarily find the amount of time that's required to go into the office and do the screening. That we are working on areas where you're not getting addressed in maybe just your regular physical. These are women who have not yet been diagnosed with heart disease. We do a pre-screening to make sure there's nothing else that needs to be addressed immediately, and then defer them to cardiology directly. We'll go over their family history, their pregnancy history. We'll go over their depression scale assessment. We're going to look at sleep and functional capacity. And then they'll get a thorough physical, and they'll work on the ankle brachial index. They'll work on their BMI, their waist circumference. So it's really lovely. They'll have the Doppler blood pressure for peripheral vascular disease as well. They'll get an EKG. We're going to do some extra labs like the LP(a) and C-reactive protein. And then they'll get a really lovely sit down with the APP to go over their customized health report. Our program is throughout the whole system. Piedmont is all the way up near North Carolina, up at Mountainside, and it's going all the way out to South Carolina in Augusta. And our goal is to get a screening. That's where you see the stars in every one of the geographical regions. So we're working toward Macon and Columbus in the hopefully near future. And the support network has education offerings pretty much throughout the whole system, from Noonan over to Augusta. So I mentioned before that we have 3 areas. I'm getting a little notification that my internet is a little unstable. Is everybody still hearing me and seeing me okay? Benita, yeah, I can see you. Can
so far, so good.
Perfect. Okay. Just in case I freeze. Now we know.
Yeah.
So we call our holistic care model, we call it the 3 buckets of wellness, and that's nourish, flourish, and thrive. So all of our programming and our coaching program flows into these different buckets. Nourish is our classes that we offer on nutrition, healthy eating. We coach primarily from plant-based eating, but we also are working with Mediterranean, DASH, and MIND. We have an array of, we have some nutritionists we're working with, as well as some wonderful chefs in the Metro Atlanta who are teaching both in-person and virtual healthy cooking classes. I mentioned the farm that I was talking in my bio, and we do field trips to the farm to learn how to grow your own herbs and to access fresh vegetables, and just to educate people about things like CSAs if they can afford it, which are, where you get fresh produce from your local farm on a weekly basis in season. Flourish is about psychosocial well-being, spiritual well-being. I would say that's the largest component of our program. We do a great deal of work in mindfulness. I am trained in MBSR and SMART. We do several different retreats. We try to combine this with the nature element, with things like going to the farm and doing nature walks, or our outdoor Qigong class that we're going to be employing over the summer. And then Thrive is all about purposeful movement. We say purposeful movement a lot because not everybody likes the word exercise, and we have to meet people where they are. But you can see that this is really more like a Venn diagram than these specific buckets. They flow into each other. When you're eating organic food on a farm, it's also psychosocial well-being. You're walking around the farm, it's movement. We teach them that this is about lifestyle hygiene as opposed to just checking boxes. I mentioned the coaching program. It's a 6-week online program. We do these 6 modules, which essentially align with the buckets. We do the values guided, value distillation, and goal setting. We establish partners. We have a nutritionist come in, a chef to teach them about presence while eating, slowing down, eating mindfully. We have a mindfulness teacher come in. We have an exercise physiologist come in, and then we work on how to make this last. We teach them about our ambassador program, where they can lead a walking group or a book club if they like, which also helps to keep those outcomes strong because now they're helping other women. It helps them to become a role model and really live in this as a new truth. And this is just some of our stats from last year, and I'm really proud of them. Our programming is hybrid, and we had 4,142 women participate in our events last year. We had 453 classes that we offered in calendar year 2025. We had about 7.25 classes a week. About 60% virtual, 40% in-person hybrid. So that's about 7 classes a week, about 6 classes that happen just on a monthly basis. And then we had about 4 special events. They were one-off events every month. So we offered there's about 28 touch points per month. We did a lot with the community as well. So opportunities where I and my other coordinator would go out and speak. So about 13 of those last year, including something like this. We work with Fayette Senior Services and Georgia Public Libraries, and we had 384 coaching referrals last year. And we're just hoping to really grow the cardio OB program. It's a serious need in the South. The maternal death rates are abhorrent. We're working on maybe getting a full-time coordinator out in the Augusta area to deal with Augusta, Columbus, Athens, a little further out from the metro. We're integrating with Salesforce for our newsletter to really update it and make it more of a destination newsletter every couple of weeks to keep the participants engaged. And we're working on increasing our referral capabilities so that we can work with more women during the year in coaching cohorts. And here's a QR code, and it just goes right to our website. You can email me directly off of there as well. And I'm just happy to share what we're doing, hoping that this is an opportunity to network with some of you. I know that our areas overlap greatly, and I do not subscribe to lack mentality. I believe that we can all, really support what we're doing, our different initiatives, and grow from this together. I hope this was useful.
Oh, very useful. Thank you so much. And I love to see those numbers and just like the diversity of the different coaching activities and education classes that, the program's offering. So very cool. I will say I will move on to introducing our case presenter and have our case presentation, but obviously if anyone has questions, please feel free to put them in the chat. We will get to question and answers after the other presentation. I will quickly share my slide again. All right. To introduce our case presenter of the day, Michal Renee is the founding executive director of the Her Promise Circle Foundation, where she designed a community-based wellness model focused on removing barriers to preventative health and wellness for women. She is a national board-certified health and wellness coach and a registered respiratory care practitioner with over 10 years of experience in critical care, where she treated and educated patients managing acute and chronic cardiac and respiratory conditions. Drawing from her clinical experience and personal experience navigating gaps in access to wellness education and support, Michal developed Her Promise Circle Foundation programs to provide women with accessible education, resources, and community support that complement clinical care. Her work centers on helping women build sustainable wellness habits so they can live healthy, balanced lives. Michal, thank you for joining us today. Please feel free to share more about your background and take it away with today's case presentation.
Sure. I logged on here like 30 minutes early because I was like, how do I share this thing? So give me a moment, y'all. Okay, share. Okay, you all let me know if you can see my slides.
Yep.
Okay, perfect. So, like Benita said, I am Michal. I am the founder and executive director of the Her Promise Circle Foundation. We have been in operation for about 4 years and finalized our 501c3 status last year. We have had many women come in to our programming, but this year we started collecting a lot of our data. And so a lot of what Avril shared, we're going to be kind of zoning in on a woman who has been engaged and for the past 3 years on the holistic initiatives that we offer. So our mission statement is to prevent burnout and crisis, because a lot of women don't enter the clinical system and get the diagnosis they need until something emergent happens. So our mission is to prevent those through providing consistent education, community, and wellness support for them. We do this in a hybrid model. So we have a virtual app as well as a location indicator on Claremont Road. Come say hi sometime. So women are able to access these things with no excuses. We tell them no excuses. So I'll move on to our case study. So Avril did a good job at showing you a picture of a lot of things that our women are facing. So mainly the women we serve tend to be women of color because they are disproportionately affected by a lot of these barriers. Actually had a few aunts pass from cardiovascular disease. So this is near and dear to my heart. So we noticed that our woman that we were talking about here in our case study, she is one of the 44% of them living with cardiovascular disease. A lot of us are not able to access mental health wellness things and resources. So that depression burden exists and keeps them from following through and being consistent on what the clinicians suggest for them to do. And also they are a huge percent of readmissions back to hospitals after emergency, after they're admitted for emergency reasons. So clinicians prescribe and we complement them by what they recommend to their clients and patients to do post discharge, by helping them to stay in touch with the community and with the holistic resources that they need that inadvertently help them become more consistent. So some of the things that she suffered from were fear, depression, fatigue, chronic fatigue at that, chronic pain. She is a caregiver, so caregiver burden. She had low motivation and limited access to all that she needed to carry out the plan that her clinicians gave her. And so this is the gap that we are built to address. So she is 49 years old, right in that gap. She lives in Tennessee. Again, we're able to remove that barrier of not being able to access the resources that they need to do the things that their doctors are telling them to do. She is married with adult children, a caregiver for a parent with dementia who has outbursts and emotional things that she goes through. So that is a huge burden upon her. She also suffers from limited mobility outside the home. She is unemployed and she receives support entirely virtually from us because of that. So, some documented clinical and psychosocial burdens she experiences are so she is diagnosed with heart disease and heart failure. Pulmonary hypertension, depression, and anxiety. She also has fibromyalgia and chronic pain, diabetes, and caregiver stress burden. So this is the exact kind of patient that we are best recommended for and to help produce a better health outcomes for, because these are the women who, again, are the ones that are unable to access the things that they need to prevent them from getting to that point of crisis. So she has been a member since 2023. And so following up to 2026 now, these are her words from 2023. We like to collect that type of survey and data from them just to see where they are when they begin and then where they are when they either stay or graduate from us, but women come and stay here. So but she is still here with us. But in 2023, these were her words: that she felt lost and hopeless, depressed all the time, always living in fear. She didn't feel like she had a real support system around her, especially not people around her that were on a wellness journey, nor understood the type of wellness she needed to receive. So she did get recommended a therapist, but the therapist she was recommended, she felt that wasn't a good therapist. That was in her words, but there were her own reasons for that. So what made her self-management at home hard were depression and fear produced from an overwhelm of she knew what she needed to do, but she was unable to overcome those barriers in order to be consistent with the things she was prescribed to do to help herself at home. She lacked that real support system, that accountability. Isolation is a huge thing, especially post-pandemic. We're seeing a lot of women struggle with social support systems, even the desire to leave the house. And that has a lot to do with their motivation to take care of themselves and to show up. Pain and fatigue, it was one of her biggest issues. And every time she would go to the doctor, they would say, you need to move more. And she's like, I'm in pain, but I don't want to do it. And so it really demotivated her and it felt unrealistic for her, really. And so she stopped completely. That caregiver burden limited her time for her own self-care. So on the days that her parent was having those outbursts, that was where all her time went, and to the things that popped up with her children and her husband. So also, support felt scattered. So we know in the social media age, there's tons of resources, tons of Instagram things, tons of freebies we can download, tons of classes, tons of courses, but it's just so much. And we reach this decision overwhelm and you kind of just reach that freeze stress response. So if you're already stressed out, already have hypertension going on, it just increases that. So this is what we factor into our programming. So we aligned her medical plan, like what the clinicians wanted her to do. This is what they were telling her to do, and went with how we indirectly support it through our holistic initiatives. So this is what the clinicians needed her to keep doing. And this is how we directly supported that between visits, so that the only time she has eyes on her shouldn't be an annual or emergency hospitalization. We see them every week. We have weekly programming. So they wanted her to take her medications consistently. So when her overwhelm was lower through our emotional regulation coaching, stress management coaching, our workshops, our community, her accountability increased. And so her follow through on her daily routines became more realistic. As part of our community wellness, we do a morning prayer call, and so many women reported that they began waking up earlier on their own because we kept them consistent in that. She was told to monitor symptoms at home and act earlier because she was getting admitted in crisis. So in those flare-ups times for her pain and for her heart failure, whenever she couldn't breathe, whether she wasn't doing CPAP at night, whatever, they wanted her to act earlier and tell them earlier. But in that state of overwhelm, it's really hard for a woman to just do the thing she's told to do. stuck in her mind. So with those community touch points, we are able to monitor her. We know her personality. We're the ones that are like, hey girl, like it's seeming like you are feeling a little more tired, feeling a little more this, what's going on? So that way we can help hold her accountable and keep her aware of her own body, her own mind, and so that she can check in with her clinician sooner. And this improves the outcome of that stay or that hospitalization if it does occur. An adherence to what the clinician tells her. So she was told to move despite the pain because that would help the pain and the fatigue. But she got overwhelmed with that because she knew what she needed to do. But we have a program called HPC Fit. Our fitness trainer is certified personal trainer and also a pre and postnatal coach. But she also does customized movement for our limited mobility patients. So we actually have clients that are 55 and above. So she creates custom movement for seniors as well as those with pain and mobility. So exercise wasn't something she dreaded or felt like, wow, I have to do this and I'm not doing it. It was like she was excited. And now she tells me every morning, she's like, oh, I clicked my video because the personal trainer made her a personal video on how to move that fits her. She listened to her. And clinicians just don't have time to do this, and so we're with them weekly, able to give them custom things to do to adhere to the plans they're given. So she was able to eat and rest in healthier ways. Community wellness, again, our public initiative. So these are pay what you can or free workshops we offer bi-monthly. And with those workshops, they leave with a takeaway that they can practically produce at home that night. She still talks about one of our rest workshops we had and how it's improved her sleep. Staying engaged with follow-up care, they told her. So virtual access kept her support reachable on those hard days. It wasn't, wow, I have to get up and go. It was, oh, let me open my phone and I have my weekly program here, my community here, and all the programs and systems that I need. And then they told, keep going emotionally. And we know just as human beings, not just women or anybody, as human beings, that's a very hard thing to be told, because whenever things happen, like grief or things pop up in life's, it's just not that easy. So with Promise Practice, that is the stress regulation coaching, and our spiritual support, again, with the prayer calls, we also have spiritual mentorship that helped reduce her feeling of hopelessness. And she was able to keep participating in her care. It just gives them hope after diagnosis. Diagnosis is not the end. And so we just wanted to show you how we support that holistically. A lot of these things are indirect, but complement clinical follow through recommendations. So Promise Practice is our stress and emotional regulation coaching. She said she felt realigned with what she wanted to do and go forward in life. That increased that chance of hope after diagnosis. HPC Fit, like I told you, that's our fitness holistic program where we customize movement for the women that come in, and they're able to attend weekly classes live and also chat with the trainer throughout. So it's no fall off. It's customized to them. The workshops that we offer. She said habit changes, absolutely. So there was poor routines and stress and low consistency, but with that direct communication with a subject matter expert, she was able to take home some of those skills right then and there. And then again, with our community and spiritual, we have a book club facilitator. So we do book club as well each month, giving them practical tools on how to implement what they read, not just collecting books and reading podcasts and all that good stuff. You're actually applying what you learn. So she said, my community has my back. And like I said, isolation's a big epidemic now, but also she was able to know someone's looking out for me. Someone's looking for me. I need to get up and go, right? And so what providers we see often face, even when I was in critical care, low consistency between visits, overwhelm. Patients are showing up at emergency moments instead of as preventative. Good plans are hard to sustain in real life. So clinicians are so knowledgeable and they diagnose, and I'd be nowhere in my health without my clinicians in my life. But those touch points, those practical touch points in daily life, as Avril also stated, are so important. And so patients who need more touch points, more ways that they can customize their plan so it's realistic so they can take it home. So how we partner, we do direct referrals. Most of our corporate or bigger business partners, clinicians, they will sponsor patients to come in that they know need this, that they know need improved outcomes and have had some pretty bad outcomes, or a lot of emergent or readmissions. We do custom workshops for hospitals and organizations. We partner specific with wellness systems for recurring touch points so that we can customize it for what their needs are, for what their patient group is. Like I said, we have maternal modalities. We also have a cardiac PA on our team. So we can adapt for cardiovascular health or more for maternal health, pre and postnatal. So some of our Q1 impacts. So we do have 218 women in our virtual app, but 45, you know how it is to get surveys. I mean, 45 of them actually engaged in our survey for Q1, 95% improved emotional regulation, 100% reduced overwhelm, and 60% went on. So even when they left our app, they were still doing those preventative things. And again, this is just a recap of what I said. I'm sure I'm over the time Benita gave me, but we are a source of referral, but also we help build, and we are also always looking for volunteers. So we can offer these things individually to women as well as to the public in our free resources and to clinicians and organizations, helping them enroll their patients into our program so that they have that consistent non-clinical support between visits, improving health outcomes and increasing their access because of our hybrid model. And you can scan that QR code to connect with us, find out more about us. Again, I am Michal. We are on Claremont Road. Benita and I went to coffee down the road, and I told her we'd never go past the office, so I never saw that coffee shop. So we're right by Golden Drops in the YMCA. Thank you guys for listening and for hearing her story here at her Promise Circle.
Well, thank you so much. That was incredible to hear. Both Avril and Michal, both of your organizations are doing much needed work, right? Because there's that significant need, especially in the South, in terms of women's health, women's cardiovascular health. So it was just inspiring to hear the different approaches that you're taking to address this with that holistic side of things as well. So yeah, this brings us to our Q&A discussion session, everyone. Please feel free to come off mute or even put questions in the chat, comments, or just ideas of how you're able to adapt this in your work. Yep.
Yeah, Micah, Avril, both of you, I take my hat off. Great job, what are you doing with your communities. Really amazed with the job you're doing. I was wondering, are these programs available in Spanish or other languages, foreign languages, or for other people to participate, or at least you have like bilingual staff on site?
Agner, that is such a good question, and that's something that I know we need to work on. Where my program has a staff of 2,
awesome.
And so unfortunately there's myself and then the person who's more shoring up the cardio OB component. The good thing is with the doctor's appointments, you know, there are services. It's more about our events and working on crossing that bridge. That's something that's up for the future. It is awesome. Definitely a need because the Spanish-speaking community parallels the other communities as well, especially the African-American community. And as a person whose mother's from Panama, I'm in both. And so, yeah, that's something we need to work on more of.
Step by step. Thank you for that, Avril. Definitely. And I do have another question, Avril. What if a woman goes to your site and she brings her husband and she said, I want my husband to participate. Do you guys have like a equivalent program, or you can refer these gentlemen to someone else, or can you also offer this program to the man population?
So this is the funny thing. Our Women's Heart Support Network, the education is open to every human. So we actually have guys who take awesome. Our meditation and our mindfulness and our yoga and our hiking. They That's cannot great. Do the coaching. That's gotcha. Only for women with an APP or a physician referral, and they can't do the $99 screening, but they can do the education. And trust me, women bring their husbands.
I know.
Or boyfriend.
I can see my wife like, no, you're doing this with me.
Yeah, and they're not going to say no.
And I will not say no. Thank you, Avril.
Yeah, we actually just recently had a partnership conversation with Black Men's Mental Health Initiative here in Georgia to do more co-ed On my Instagram, I get a lot of guys reach out and say, "Can guys come to this fitness class? Because we have one coming up in person on May 16th." And I'll have guys reach out. So because of that, I mean, I don't limit it. I those kind of in-person public things, I let them come to. I mean, if they need it, they need it too. They're also disproportionately affected, especially men of color. So yeah, but we are working on actual programming with other mental health initiatives that are going on here in Georgia.
Thank you.
And our fitness trainer is bilingual, by the way.
Great to hear that.
There may be some opportunities to partner, excuse me, with local and state public health as well. Their resources are limited for men too, but in partnership, you may be able to reach out across your community and expand your network along with them, because local and state public health are always looking for resources for men too.
We are in their book, the county book, for resources, but we're also part of the Live Healthy DeKalb Healthy Coalition team. We're on the health equity team. So definitely connect. I think that's how I met Benita, actually. But I'm definitely connected with them, and we stay on top of how we can insert ourselves to be able to do like some of the events that they do and plug into that, and offer more for them as far as expanding their reach, especially since we do virtual things as well.
Absolutely. And when they do their community assessments, make sure that you're taking the survey and the assessment, so that your needs stay top of mind with them.
That's great advice. Thank you.
One last question. Okay. I know for a fact that the only objective a person should have as a, I don't know, a self that wanted to do this, the only incentive should be, overall health. I'm improving my health overall. But, sometimes people like to have some incentives, like, I don't know, $25 voucher for participating in the next 5 or 6 sessions. Do you guys have something like that, some incentives besides of the overall health that the people will, of course, gain after these programs?
Not for us, because we're philanthropically funded, so that would be maybe not the best choice when we're trying to maximize the number of participants and utilize these resources very skillfully, because they are, everything costs a lot. Just our software alone is going to be like $10,000 for the next year. So no, but I think a big incentive is when they're getting the professional referrals, like APP and physician. That adds a little more credence to it. So we're working on increasing the volume from that, where we're hoping to get all new female patients to PHI, that's Piedmont Heart Institute, to get like an automatic referral to our program, and hoping that incentivizes in that way.
Awesome. And one more last question, Avril. What do people? I know $99. It looks like a very good price for the program
it's a
that you're
barrier
offering.
for some people.
But
I got
definitely
that. Yeah.
So there's like payment plans for the people that can pay those 99 fees immediately, or
So it's
scholarships.
That the scholarships, that is something that it looks like that may not be being able to be offered, because there's like a patient mining component. Because if you find out that someone has something, then they have to go to us for treatment. And if they're not insured or something, so trust me, we've thought about that. I thought, could we take a fund and donate this many screenings?
Okay.
But we do mini screenings. And we do those at like Fayette Senior Services, where we'll do the cholestech and we'll do the blood pressure, and we'll just talk about risk factors. So we can do something like that, but we cannot do something where if we find something wrong that you have to see a physician, because it can be considered nefarious. So that's an issue. I've never had anybody suggest payment plans. Like, actually, that's something that I will bring up in the next meeting. That could be a great idea. Absolutely. I will be talking to that with my director, who's somewhere on this call right now. Hey, is that an option? But we definitely, the way that it's done, it's you're paying, instead of the way that it would be processed through insurance, it's much cheaper the way that we do it than if you just try to direct pay. It's like a bundle, but installments may be an option.
That will be awesome, definitely. Hey, but I'm a community health worker, so I always speak, on behalf of the communities that we are serving, and I have always then on my mind when I'm doing these questions. I'll put myself in the, in the shoes of the other people. That's why I'm asking.
I'm always aware that $99 I can teach. Like, I was at the Reynolds Ladies Club at Lake Reynolds
Awesome.
teaching a women's heart program event. Their ladies club invited me. To them, $99 was like poo-poo, And then I'll be at Rockdale Rockers with their seniors group that meets in a hospital, feeling like, I know $99. It's so amazing, the perception.
Definitely.
So I'm very aware, and it's bothered me before, but we have to address it through the proper channels. So
Thank you.
Yeah, we offer payment plans for our access to our app because it's similar to hers as well. Their group, ours is $97 for the month for everything. So for everything, but women can sign up for sponsorship. Most of them do. And then we also offer the free. So there's many options for them to, if they can or cannot, through however many women sign up. We're also giving some away. So that's kind of our incentive. And how we're making it affordable. I mean, a gym membership is more than that nowadays. So it's like we're offering everything, just like Piedmont Heart Health Group. So
just to piggyback off of that, do you offer any types of transportation, either of your programs? That's so difficult, especially now when gas prices going up, and it makes it difficult for people to even get to work.
We can see you again, Michael. You were frozen for a moment, but now you're back. It's just moving a little slow. Sylvia, no, we do not, because of things like the liability that would be assumed by our program. That would just be a little too much. But as I mentioned, more than half of our programming is either hybrid or virtual. There are very few in-person programs that we offer that are only in person, except for things like our nature walks, our nature hikes. Everything else is being done hybrid as much as possible. So that way we can eliminate that. We are going more to hybrid than just virtual because there are people who really want to connect in person. So that's how post-pandemic, but we are streaming like Qigong every week, yoga every week. Twice we have yoga classes that are free that are hybrid, and then every other one is virtual. Twice a week we have Qigong that's free for hybrid, but every other one is virtual. So we have a ton of programming that can be done from home.
That's outstanding. I was thinking more along the lines of those that get referred to medical care too, and sometimes health systems, once they get into the system, have some options for transportation for those types of important.
Yeah, the coaching program, which is the only part that's fully physician referred, is only virtual. We do not do it in person.
Okay, excellent.
Because of that, and because we want people to be able to do the 6 weeks in a row and have the least amount of things get in the way. And in Metro Atlanta, you're stepping out of your door is getting in the way. We've tried it in person. We tried, and it's like the traffic alone. And then what's a good time? The good times that people are home, rush hour is the worst. So it is in the evening and it is online from the comfort of your home. We tell them to have a cup of tea. It's like we're having a tea party together, but it's done from home.
Outstanding work. Thank you both.
Oh, and thank you. I appreciate your suggestions.
Yeah. Sorry to cut you off. Thank you both for the amazing presentations and everyone for your questions. It really helped us get an insight, into the programming aspect of things. We only have a couple of other agenda items left. So this was just another timely heart health resource I came across that I thought it would be great to share. So the Live to the Beat coaching program is a free virtual experience designed to help people take small, realistic steps towards heart health. So their next session is actually coming up next week about taking charge of your blood pressure. I think it's scheduled for both May 5th and the 7th, but they also have 3 other sessions. So spots are limited. So if you're interested or want to share this with your networks, go ahead and do that. The registration links on the slide will also share it via email after the session's over. Our next ECHO session will take place on Thursday, May 28th from same time, 12 to 1 p.m. Eastern Time, where we will be highlighting the maternal cardiac program at the Northeast Georgia Health System. And we're very excited to welcome Dr. Bridget Shulman and Savannah Sanders to share their work. Keep an eye on your inbox for the registration link and session reminders. And before we end the session, we'd like to bring your attention to receiving certificates and credits for your participation today. So your ECHO attendance this month accounts for 1 AMA PRA Category 1 credit for physicians and 1 Certified in Public Health recertification credit. So to receive the certificates or education credits, please complete the post-ECHO survey. The link is on the slide, and Agner already shared it in the chat. Thank you, Agner. We request that you complete the survey either now or by close of business May 14th. Your responses truly help us to tailor these sessions. And if you're seeking continuing education credit, make sure that you are registered on iEcho, and because completing the survey is required. So you can fill it out now using the link or save the link and come back to it later. Thank you in advance for your feedback. And finally, thank you again to everyone for joining us today and our presenters, Avril and Michal, for a wonderful presentation on holistic women's heart health. We hope to see everyone for our May session on May 28th.